It's been a long time. We shouldn't have left you without a dope beat. Step 2.
It's about time for the part B of diabetes. Let's hurry. Welcome back, everyone. We will continue from where we stopped. Dr. Yvonne is away for another meeting, and so Dr. Kate Ngozi and I will facilitate this session.
Thank you, Dr. Emmanuel. Let's quickly look at the complications of diabetes. The complications of diabetes occur mainly as a result of damage to the blood vessels. Diabetes doubles the risk of cardiovascular diseases, that is, diseases of the heart and blood vessels. About 75% of deaths in diabetes are due to heart diseases and stroke. Diabetes also damages the eyes, which can lead to blindness. It also damages the kidneys, which can cause a chronic kidney disease, requiring a kidney transplant or a lifetime dialysis. You may have heard of diabetic foot ulcers. This is as a result of damage to the nerves caused by a high blood sugar, and commonly presents with symptoms such as pain, numbness or inability to feel, tingling sensations or feeling of pins on your body. Diabetes also causes altered pain sensation, where you don't feel anything. This is dangerous because responding to pain helps us to avoid whatever is causing the pain. And if you lose your ability to feel, you get prone to more injuries, typically auto-amputation of your toes, which is when your toes fall off on its own. Now thought's very scary. Dr. Emmanuel will carry on.
Thank you very much, Barrister Dr. Kate. Finally, we need to know how to reduce our chances of having diabetes and prevent the complications associated with diabetes. The very important approach to reducing the risk of diabetes, or preventing its complications, in those with an established diabetes, is to reduce the levels of sugar in the blood, as this is the primary problem. And how do we do this? 1. Fight obesity by exercising and eating less sugary foods. Remember our heart attack session? And what happens to the pancreas in obesity? You should watch that again. Obesity is the major and most common cause of diabetes, so a daily purposeful exercise helps. 2. A family history of diabetes should prompt immediate lifestyle adjustment in terms of developing a healthy food habit by reducing the intake of calories, sugary foods, and exercising. If you are already diabetic, do not panic. Reducing your blood sugar will help greatly. So take the blood sugar lowering drugs prescribed to you by your doctor. Exercise. Check your blood glucose levels monthly or as advised. Reducing your sugar also reduces your risk of infection. Reduce excessive calorie intake. Ideally, a dietitian will help you choose foods which are recommended in diabetes. Report side effects of your drugs to the doctor. Note that hypoglycemia, a low blood sugar, evidenced by shakiness or feeling of fainting when taking your blood-lowering drugs, is the most common side effect, and usually a bottle of Coke or any beverage will help revive you. In the event of this, Barrister Dr. Kate will highlight a very important concern before we end this session.
Thank you, Dr. Emmanuel. Dear viewers, depression is common in a lot of diseases, as it is in diabetes. It is usually difficult to accept that you have a disease. I mean, even as a doctor, I will definitely find it hard to accept I have a health problem. Nevertheless, I want to encourage us. It is never the end of life when we get diagnosed with a medical condition. Your mental health is very important and helps prolong your life. Go ahead, Dr. Emmanuel.
Our dear audience, very important. Please be calm. Be open. We have our email address on our page's info. Feel free to email us. We are ready to share your worries with you and see how we can best provide a solution to them. Depression is a key determinant in the outcome of treating diabetes. It must be dealt with, as it causes a burden on the patient and reduces the overall chances of a prolonged survival. Please note that diabetic patients whose sugar is not controlled are prone to a heart attack, which is termed as a silent heart attack, or silent myocardial infarction. This is a very dangerous form of a heart attack because the patient doesn't get any of the classical warning signs of pain associated with a heart attack. Heart attacks in diabetic patients can be prevented by controlling the high blood sugar. We hope you enjoyed this session and have learned a lot. We will see you in our next health awareness animation. Thank you for watching. Goodbye.
It's been a long time. We shouldn't have left you without a dope.